Hi, I'm Soirindhri. I am a clinical oncologist working in the NHS in the UK. I think the most challenging part of being an oncologist is to have long, difficult conversations with your patients when they come with a new diagnosis of cancer to discuss the extent and the stage in which the disease has presented, and to talk about the various treatment modalities and the options of cure that we can offer to them. And a very important part of this conversation is to try and achieve that balance between giving full detailed information about what the cancer looks like, how bad it is, how aggressive it is, what the prognosis can be, which simply means the outcome, the expected outcome with or without treatment of the disease in itself, and to be honest and to provide hope about the treatment options that can be explored and what each of them entails, the pros and cons of each of those options, how we intend to treat, and how we intend to potentially cure a patient. So, talking about survival data, talking about the effects on quality of life from the treatment, and to letting them know that this is not a dead end and there is always a way forward. Um, I think these conversations have become easier with time now because of the massive progress advancement in research and clinical trials in cancer care over the last few decades. And we've now moved to a time when we talk about minimally invasive surgeries to remove only the tumor, leaving behind the rest of the organ and not remove the whole of the organ instead. So, better surgical outcomes, better quality of life post-op. We talk about precision radiotherapy, where we are able to selectively, precisely delineate the tumor and target it with ionizing radiation while sparing the normal adjacent organs. Again, minimizing side effects of treatment. We also talk about massive advancement in systemic anti-cancer therapy in the sense that we are now treating cancer, especially metastatic cancer, cancer that's spread to other organs, by things called immunotherapy, targeted therapy, monoclonal antibodies, anti-cancer hormones, anti-cancer vaccines. And these essentially target genetic mutations and specific proteins that only the cancer cells are positive in and not the normal non-cancerous cells. So again, end result is minimum side effects. So with this kind of advancement in cancer care, we are now looking at better cure, uh, more survival, and better quality of life, less side effects from each treatment. So, less toxic treatment and more hope is what we are now at. Um, I think the success of these conversations also depends a lot on the reception of the patients, because oftentimes we find that the patient has they suffer from information overload when these conversations are over, and there's too much that has been shared, not meaning much to the patient. So essentially, a hack to make these conversations successful is to bring up the scan reports, and the reports which show the tumor on the scan, so MRI, CT scans that may have helped in diagnosing the condition, to bring them up on the computer while you are talking to the patient, to show your patient what exactly the cancer looks like, the area in specific that harbors the disease, or how big the tumor is, how much of it has gone to the adjacent organs, or how localized it is. It just helps in simplifying the whole thing to the patient, helps the patient understand what the patient is suffering from, and then to talk about the mode of treatment, the mode of action that each of the treatments entail, and how exactly we intend to specifically kill the cancer cells while sparing the normal tissues. So essentially talking about the mechanism of action of the treatment in question. So this is, I think, what makes these conversations easy, conversations successful, and with good outcomes for the patient to understand that there is hope. It's not that every cancer at every stage is incurable. I do agree that when a patient comes with metastatic disease that has spread to other organs, the conversation is more difficult because hope is minimum. We don't talk about curing the disease, but to palliate symptoms and to increase longevity and survival as much as possible, to give a better quality of life instead of making a patient cancer free. So in that setting, definitely it is very difficult to achieve that balance between giving correct information, honestly talking about poor prognosis of a disease, as well as to give hope to a patient. But we are getting there with more and more research. We will potentially have easier conversations even when we talk about metastatic disease. Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.